Here we are. So Susan, why do we need sustainable procurement in the health sector? And what are the biggest challenges and opportunities for sustainable procurement in China?
We're here in Beijing for the launch of the Sustainable Procurement in the Health Sector project. And we need sustainable procurement in the health sector because it is the linkage between health and environment. We know that 1/4 of the global burden of disease among the human population is the result of environmental exposures and environmental degradation. We also know that the health sector contributes to that pollution that has an impact negatively on health. So that when we look at the products and services that we are buying, we can choose products that are healthier and safer, that have a reduced carbon footprint. Challenges we faced are having information about the alternative products and about raising awareness among health professionals that some of the disinfectants that they're using cause asthma, that some of the anesthetic agents, there are safer ones that have a lower carbon footprint because anesthesia, if it goes into the atmosphere, is 400 to 1,000 times the impact of carbon equivalent. So there are many products in healthcare that we can choose to be better for health and the environment.
Great, thanks. This is my personal question. What do you think the, for example, the artificial intelligence, driverless car, for example, or the artificial intelligence in the healthcare sector? So what's their role currently and in the future? What do you see of the AR technology?
Well, I like to think of technology as the balance between high tech and high touch. And there is no technology that will replace the human touch and the human kindness to provide service to people. That said, there's so much processing that we need to do to analyze data, to transport goods that will be better done by robots or by computers.
But
we need to work together.
I see.
I also wanted to add one of the challenges is change. We're looking at changing the way healthcare is provided, emphasizing prevention over treatment and cure, looking at public health versus disease models. We're looking at changing products and the way people move and do their work. And change is always hard. So having the information, the support, and the regulatory reinforcement to do what's best for people and the planet.
That's great. During the panel discussion, you also mentioned the transparency, which is a great thing China and also the other countries should consider during the greening the health sector. So could you answer this a little bit?
Sure. Transparency is important in healthcare procurement in a number of ways. Transparency of the materials that are in products, so we know what the chemical makeup is, so we know what the carbon content is, and we can evaluate alternatives equally. Transparency is also critically important in decision making, so that the decisions that are made to promote and protect health can be replicated by others, and so that there is fair and equitable access to service.
Great, thank you, Susan.